What is gluten? Gluten is a protein found in wheat, barley, and rye food. Gliadins and glutenin are the two main components of gluten. Gliadins is pathogenic component of gluten. It causes immune-mediated damage to the small bowel villi. When someone with a genetic predisposition to celiac disease consumes gluten, it is going to be broken down into gliadin and glutenin by a series of enzymes called protease. Gliadin goes to the small intestine and bound a secretory IgA in the mucosal membrane of the small intestine. IgA is a type of antibody that helps protect our gut from pathogens. Transferrin receptors usually absorb iron. For an unknown reason, it is overexpressed in patients with celiac disease. Once gliadin and IgA complex bound to this receptor, it transcytoses across the cell membrane from the apical to the interstitium. In the interstitium, an enzyme called tissue transglutaminase, TTG, removes the amide group from gliadin. Deamidated gliadin then phagocytoses by macrophages and presented on its MHC class II molecules to CD4-positive T helper cells. T helper cells, also known as CD4-positive T cells, recognize and interact with the gliadin and release inflammatory cytokines, which are molecules that initiate inflammation like interferon gamma and tumor necrosis factor. These inflammatory cytokines are molecules that initiate inflammation and directly damage and destroy the villi of epithelial cells in the small intestine, mostly the duodenum. The helper T cell also releases interleukin-5, which stimulates B cells to differentiate into IgA-producing plasma cells. Plasma cells now start producing large amount of IgA antibodies against the gliadin, the tissue transglutaminase, and endomysium. These antibodies are against transglutaminase found in the endomysium, the fine connective tissue sheath that surrounds muscle fiber. They don't cause any muscle-related issues, but they help with diagnosis. All these problems of celiac disease mainly take place in the small intestine, mostly in the duodenum. Jejunum and ileum involves to a lesser extent, but the duodenum is where most of the damage takes place. The villi of the small intestine are destroyed and flattened out, and the crypts also get longer, which is called crypt hyperplasia. Symptoms: in children, abdominal distension, diarrhea, and failure to thrive. Adult, chronic diarrhea and bloating. Associated conditions: dermatitis herpetiformis. Laboratory findings: IgA antibody against endomysium, tissue transglutaminase, or gliadin. In the case of IgA deficiency, we need to test IgG antibodies because some patient shows IgA deficiency, so we cannot find IgA antibodies in the serum. In such cases, we need to test IgG antibodies against endomysium, tissue transglutaminases, and gliadin. Biopsy shows flattening of duodenal villi, hyperplasia of the crypt, and inflammation. Jejunum and ileum are less involved. Symptoms usually resolve with a gluten-free diet, but still, some people are at risk of developing refractory diseases such as small bowel cancer and T-cell lymphoma. This is because of chronic inflammation and immune system activation.